Understanding hypothyroidism is crucial. It is a common medical condition that occurs when the thyroid gland doesn't produce enough thyroid hormone. This hormone is crucial as it regulates metabolism. For medical students, understanding hypothyroidism is essential. You will encounter it frequently in your practice. Recognizing the subtle signs and symptoms is important. You will need to know how to diagnose and manage it effectively. This guide provides a comprehensive overview of hypothyroidism. We will cover its causes, diagnosis, treatment, and more. The thyroid gland is a small, butterfly-shaped gland. It sits in the front of your neck, just below the Adam's apple. Despite its size, it plays a huge role in your body. The thyroid gland produces two main hormones, triiodothyronine, or T3, and thyroxine, or T4. These hormones are essential for regulating metabolism. Metabolism is how your body uses energy. Thyroid hormones affect almost every cell in your body. They influence heart rate, body temperature, and even how your brain works.
Hypothyroidism occurs when the thyroid gland doesn't produce enough thyroid hormone. This small butterfly-shaped gland located at the base of your neck plays a crucial role in regulating your metabolism, energy levels, and overall hormonal balance. This can happen for various reasons, each affecting the gland's ability to function properly. The most common cause is Hashimoto's thyroiditis, an autoimmune condition. This is an autoimmune disorder where the body's immune system mistakenly attacks the thyroid gland, leading to inflammation and impaired hormone production. Over time, this can cause the gland to become underactive. Other causes include previous thyroid surgery, radiation therapy to the neck, and certain medications. These treatments can damage the thyroid tissue, reducing its ability to produce hormones. Sometimes the problem isn't with the thyroid gland itself, but with the regulatory mechanisms in the body. It might be with the pituitary gland, which sends signals to the thyroid to produce hormones. The pituitary gland, located at the base of the brain, releases thyroid-stimulating hormone, TSH, to control thyroid function. This is called secondary hypothyroidism. In this condition, the thyroid gland is normal, but it doesn't receive enough stimulation from the pituitary gland to produce adequate hormone levels. This can result from pituitary tumors, surgery, or radiation.
The symptoms of hypothyroidism are often subtle. They can be mistaken for other conditions. Common symptoms include fatigue, weight gain, cold intolerance, constipation, dry skin, and hair loss. Patients may also experience depression, muscle aches, and difficulty concentrating. It's important to note that these symptoms can vary from person to person. Some individuals may experience only a few mild symptoms, while others may present with a wider range of more severe symptoms.
Section 5. Diagnosis, confirming your suspicions. This section will guide you through the essential steps and tests involved in diagnosing hypothyroidism, ensuring that your suspicions are either confirmed or ruled out with precision. Diagnosing hypothyroidism involves a combination of medical history, physical examination, and laboratory tests. The process begins with a thorough review of your medical history, where the healthcare professional will ask about your symptoms, family history, and any other relevant health issues. This is followed by a detailed physical examination to check for signs such as dry skin, swelling, and slow reflexes. The most important test is a blood test that measures thyroid-stimulating hormone, or TSH levels. This test is crucial because TSH levels provide a clear indication of how well your thyroid is functioning. TSH is produced by the pituitary gland, a small but vital gland located at the base of your brain. It plays a key role in regulating your body's hormone levels. It tells the thyroid gland to make more thyroid hormone. This communication is essential for maintaining the body's metabolism, energy levels, and overall hormonal balance. In hypothyroidism, TSH levels are elevated because the pituitary gland is trying to stimulate the thyroid gland to produce more hormones. This elevation is a compensatory mechanism indicating that the thyroid is underactive. A low level of free T4, the active form of thyroid hormone, confirms the diagnosis. Free T4 is the hormone that directly affects the body's metabolism and energy levels. In some cases, antibody tests may be ordered to check for autoimmune thyroiditis. These tests look for specific antibodies that attack the thyroid gland, indicating an autoimmune condition such as Hashimoto's thyroiditis. This additional testing helps to pinpoint the exact cause of hypothyroidism, allowing for a more tailored treatment approach. Section 6. Management: treating hypothyroidism effectively. Hypothyroidism is a condition where the thyroid gland does not produce enough thyroid hormones, leading to a variety of symptoms such as fatigue, weight gain, and depression. The primary treatment for hypothyroidism is levothyroxine. Levothyroxine is a synthetic form of the thyroid hormone thyroxine, which is normally produced by the thyroid gland. This is a synthetic form of thyroid hormone. It works by replacing the deficient hormone in the body, thereby normalizing the body's metabolism and energy levels. It's taken orally once a day. Consistency is key, so it's important to take it at the same time each day, preferably on an empty stomach for better absorption. The goal of treatment is to restore normal thyroid hormone levels. This involves not only alleviating the symptoms, but also preventing long-term complications such as heart disease and infertility. This relieves symptoms and prevents complications. Patients often report significant improvements in their energy levels, mood, and overall well-being after starting treatment. The dosage of levothyroxine is individualized based on the severity of the hypothyroidism and the patient's response to treatment. Factors such as age, weight, and other medical conditions are also considered. Regular blood tests are essential to monitor thyroid hormone levels and adjust the dosage as needed. These tests help ensure that the thyroid hormone levels remain within the optimal range, preventing both undertreatment and overtreatment. Pregnant women with hypothyroidism require careful monitoring and dosage adjustments. Proper thyroid hormone levels are crucial for the health of both the mother and the developing fetus, making regular checkups and adjustments vital during pregnancy.
Section 7. Complications: recognizing and addressing potential issues. Untreated hypothyroidism can lead to several complications. One of the most serious is myxedema coma. This is a rare but life-threatening condition. It's characterized by hypothermia, altered mental status, and respiratory depression. Long-term hypothyroidism can also increase the risk of heart disease. This is fertility, miscarriage, and birth defects. Early diagnosis and treatment are crucial to prevent these complications.
Patient education is a vital aspect of managing hypothyroidism. Patients need to understand the importance of medication adherence. It's also important to recognize the symptoms of both undertreatment and overtreatment. Patients should report any changes in their symptoms to their doctor. Dietary considerations, such as limiting goitrogenic foods, may be helpful for some patients.
Hypothyroidism can be associated with other endocrine disorders. These include type 1 diabetes, Addison's disease, and celiac disease. Certain conditions, such as depression and chronic fatigue syndrome, can mimic the symptoms of hypothyroidism. It's important to consider these conditions in the differential diagnosis.
The American Thyroid Association, or ATA, provides clinical practice guidelines for the diagnosis and management of hypothyroidism, ensuring best practices. These guidelines are regularly updated to reflect the latest scientific evidence and advancements. Current research is focused on developing new and effective treatments for hypothyroidism. This includes novel thyroid hormone formulations and innovative immune-modulating therapies. Studies are also underway to better understand the genetic and environmental factors that contribute to hypothyroidism, aiming for comprehensive care.
Hypothyroidism is a prevalent endocrine disorder. It can have a significant impact on a person's health and well-being. For medical students, a solid understanding of hypothyroidism is essential. You will need to be able to accurately diagnose and manage this condition. You will also need to effectively educate your patients about their condition. By staying informed about the latest research and guidelines, you can provide your patients with the best possible care.